Hi! Kami po ang personnel ng Police Community Relations Section ng PSPG-PNP at inaanyayahan po namin kayo na manood at makinig sa programang Imay na Guardia DATUIN na Anghel de la Guardia. Basta PSPG, trustworthy! Via online at La Guardia News Online and Radio through AFP Radio 1134 kHz AM. Tara! Samahan niyo po kami!
Lahat na ngayon online. Online shopping, online meeting, online payment. Sa PhilHealth, narito na ang aming tugon sa inyong request para sa mas mabilis at pila-free payment para sa mga self-earning individuals. Sa pakikipagtulungan sa iPay MYEG Philippines Incorporated, inilulunsad ng PhilHealth ang pagbabayad ng contribution online. Paano ang pagbabayad? Mag-login sa www.philhealth.gov.ph. Piliin ang online services. I-click ang PhilHealth Member Portal at mag-create ng account. Hanapin ang Payment Management at mag-generate ng Statement of Premium Account. Piliin ang paraan ng pagbabayad. Para sa debit o credit card, kumpletuhin ang lahat ng mga hinihinging detalye. Ibigay ang one-time PIN o OTP na ipinadala sa iyong mobile number. Para sa GCash, piliin ang mobile payment method at i-click ang GCash. Ibigay ang iyong GCash number. Ilagay ang GCash MPIN na ipinadala sa iyong mobile number. Isang confirmation receipt ang matatanggap para sa successful na pagbabayad. Sa PhilHealth, lubos naming hangad ang mas ligtas na pamilyang Pilipino. Magbayad na ng inyong contribution online. Para sa karagdagang impormasyon,
ito po si Martin Aguda. Kayo po ay nakikinig sa Anghel de la Guardia ni Mike DATUIN.
Sariling kalayaan ay kinalimutan. Sana'y upang mapapilan sa hukbo ng sandata. Mahal sa buhay ay nilisan dahil sa pangarap na maglingkod sa inang bayan. Kapayapaan ang bitin, sakripisyo ng bawat sundalo. Buhay ay laging nasa peligro sa panahon ng digmaan. kabanata ng isang away na hindi kalilimutan. Hirap at pagod ay lalampasan dahil sa pangarap na makamit ang kapayapaan. Kapayapaan ang bitin. Sakripisyo ng bawat sundalo. Buhay ay laging nasa peligro. Sa panahon ng digmaan, lumalaban na may tapang. Iaalay ang sariling buhay para sa kabayanihan. Sakripisyo ng bawat sundalo. Buhay ay laging nasa serbisyo. Sa panahon ng digmaan, lumalaban na may tapang. Iaalay ang sariling buhay para sa kabayanihan. Iaalay ang sariling buhay para sa kabayanihan. Iaalay ang sariling buhay para sa kabayanihan.
Ako po si Bong Lebriha, ang head ng EDSA Special Traffic and Transport Zone ng MMDA. Kayo po ay nakikinig sa Anghel de Guardia ni DWDD. Samahan niyo po kami.
Narito ang makabuluhan at siksik na talakayan. Ang programang may puso at kapupulutan ng aral ukol sa seguridad at kaligtasan. Umaksyon, maging alerto. Anghel de la Guardia.
Blaze Records. Easy.
Isang masaya, mapayapa at ligtas na araw na Luzon, Visayas at Mindanao.
Huwag ka na malungkot, andito na ako. Pupunasan ko ang luha sa mga mata mo. Di ka na magdurusa pagkat ako magsisilbi sa'yo.
Binabati natin ang lahat ng mga Pinoy all over the world mula sa Amerika, nasa Europa,
Ngumiti ka lang
UAE, Qatar,
lahat ng iyong
at sa
hirap at
Russia.
masakit ay merong sagot.
Ating kakwartihan,
Sa madilim mong mundo
tundaluhan,
na nababalo.
kapulisan,
Bubuksan ko yan at
kakibat sa public
bibigyan ko ng
safety,
liwanag.
peace and
Magtiwala
order,
ka
mga
lang
empleyado
at
ng
huwag kang
pamahalaan,
mapagyabang.
mga ordinaryong
Andito ako,
manggagawa, may
handa
kapansanan
kitang
ka man o
ipaglaban.
wala,
Kahit anong
ang
mangyari,
ating mga
di kita
kabataan
iiwan.
o ang ating
Huwag ka
mga
na malungkot,
tinatawag
andito
na
na ako.
millennial.
Pupunasan
Mula po
ko
sa
ang
amin
luha
dito
sa
sa
mga
programa
mata mo.
Anghel
Di
de
ka
la
na
Guardia,
magdurusa pagkat
programang
ako magsisilbi
para sa
sa'yo.
Gwardyang Pilipino,
Anghel
karapatan
de la
ng mga
Guardia.
manggagawang
Huwag
tagaligtas
ka na
at
malungkot,
lahat ng
andito na
manggagawang
ako.
Pilipino ukol
Pupunasan
sa
ko ang luha sa
kaligtasan at
mga mata
kahandaan.
mo. Di ka na magdurusa pagkat ako magsisilbi sa'yo.
The
Anghel de la
national
Guardia.
security community,
Hindi
whole of
ako si
government and whole of
Superman.
society
Ako'y
working
normal na
together
tao
Right.
lang. Handa makinig
para
at
ayusin
pwede
yung
mong sandalan.
intergenerational
Kaibigan
problem na yan.
kita,
Si
pero
Chairman
sa
mismo
kabilang
nagpunta
banda,
doon to see
pero mahal
ginagawa
mo
ng
rin
mga
siya.
tropa
Di
ng
ako naghahangad
mandato
na
na
mahalin mo
mag-check
rin
ng mga
ako.
drivers,
Pero sana
lalong-lalo
mapansin
na yung
mo
mga
ang
babiyahe na
pagtingin ko
malayo.
sa'yo. Kahit ang turing mo sa
Ako
akin
po ang
ay
inyong
isang
lingkod,
Anghel de la
Mike
Guardia.
Laguardia,
Ayos lang,
datuin,
basta alam kong
nagbabalita,
masaya ka.
naghahayag at
Huwag ka
naglilingkod
na
para sa
malungkot,
kaligtasan
andito
at
na ako.
kapayapaan ng
Pupunasan
bawat
ko ang luha sa
mamamayan.
mga mata mo. Di ka na magdurusa pagkat ako magsisilbi sa'yo. Anghel de la Guardia. Huwag ka na malungkot, andito na ako. Pupunasan ko ang luha sa mga mata mo. Di ka na magdurusa pagkat ako magsisilbi sa'yo. Anghel de la Guardia. Huwag ka na malungkot, andito na ako. Pupunasan ko ang luha sa mga mata mo. Di ka na magdurusa pagkat ako magsisilbi sa'yo. Anghel de la Guardia. Huwag ka na malungkot, andito na ako. Pupunasan ko ang luha sa mga mata mo. Di ka na magdurusa pagkat ako magsisilbi sa iyong Anghel de la Guardia.
Seguridad at kaligtasan ay responsibilidad ng bawat mamamayan. Mapasaan ka man, lakasan ang loob at magtiwala dahil lahat tayo ay may Anghel de la Guardia. Isang mapayapa at ligtas na araw, Luzon, Visayas, and Mindanao. Sa lahat ng ating mga tagsubaybay ng programang Anghel de la Guardia, dito pa rin sa La Guardia News Online FB page at sa DWDD 1134 kHz AM radio via at AFP Radio FB page. Ang programang ito ay hatid sa atin ng La Guardia News, tanod na malayang Pilipino. Binabati po natin ang lahat ng mga Pinoys all over the world mula sa Amerika, Europa, Middle East at sa lahat ng bahagi ng Asya. Mula po sa amin dito sa programang Anghel de la Guardia, ang programang para sa Guardiang Pilipino, karapatan ng mga manggagawang tagaligtas at lahat ng manggagawang Pilipino ukol sa kaligtasan at kahandaan. Ako po ang inyong lingkod, Mike Laguardia, DATUIN po, nagbabalita, naghahayag at naglilingkod para sa kaligtasan at kapayapaan ng bawat mamamayan. Usapang Philhealth. Kasama po ang ating mga co-host tonight or ngayong programang ito. Of course, we are Region 10 partners Lynn YBANEZ and Michael Lahi. Yan po, inaanyayahan po natin ang lahat na sumubaybay, sumali sa usapang, magkomento, magbigay ng reaksyon at opinyon sa pamamagitan ng pag-type nito sa ating comment space dito sa ating Facebook page at La Guardia News Online FB page or sa ating replays 1134 kHz AM radio mula alas 3 hanggang alas 4 ng hapon tuwing Sabado, or sa FB naman via at AFP Radio FB page or sa aking Michael DATUIN YouTube channel sa pamamagitan naman ng inyong pag-livestream. O huwag niyo pong kalimutang i-like and share ang ating pong live broadcast ngayon to your friends and friends timeline. Again, review us at AFP Radio or at La Guardia News Online FB pages or at Michael DATUIN YouTube channel if you've missed this live program. Ating Usapang Philhealth. Inoobserbahan natin ang National Women's Month ngayong buwan ng Marso na may tema, We Make a Change or We Make Change, Work for Women, Agenda ng Kababaihan tungo sa kaunlaran. Inoobserbahan din natin ang Women's Week tuwing unang linggo ng Marso, aling-sunod sa Proclamation No. 224, Series 1988. Bukod dito, pinagdiriwang natin ang International Women's Day noong ika-8 ng Marso na may campaign theme hashtag Break the Bias or hashtag Break the Bias. Layunin din ng Pilipinas na mapalagaan ang kalusugan or mapangalagaan ang kalusugan ng ating mga kababaihan. Kasali po ito sa Sustainable Development Goal ng United Nations kung saan nakasaad ang mga sumusunod: reduce maternal mortality and all preventable deaths under 5 years of age, universal access to sexual and reproductive care, family planning, and education, achieve universal health coverage achieve universal health coverage. Dahil dito, nagpalabas ang PhilHealth ng mga benepisyo para sa kababaihan upang makamit ang mga nabanggit na layunin. And of course, to share all of these with us, allow me to call on my co-host, walang iba kung hindi si Kuya MJ Lahi.
Yeah. Good evening, Kuya Mike. Good evening po sa mga viewers and listeners ng Usapang Philhealth via La Guardia News Online. Kuya Mike, dalawa lang po tayo kasi si partner Lynn is now busy sa Cagayan de Oro kasi our President and CEO in the person of Attorney Dante Giran is having his official visit in Cagayan de Oro. So busy si RBP DELIO ngayon, partner Mike.
Yes, yes. At yun nga, nabalitaan ko nga. Pero I'm sure that will not stop Region 10 for broadcasting the good news tonight. And I'm very grateful to have you joining us tonight. And for sure, dahil Region 10 ay medyo busy, Region 9 daw ang
Region 9 ang,
sasalo. So tama ba?
yeah, yeah, yes, Sir Mike, kasi even though we are from this other different regions, Team PhilHealth ho tayo, Kuya Mike. So dapat
Exactly.
tulong-tulong lang kasi Team PhilHealth ho tayo.
So speaking of tulong, kadalasan naman ng mga kasama natin sa laban ay ang ating mga wives or ang ating mga friends. So with that, I think yung ating mga kababayan
Guest.
ay talagang nasa buwan nila ngayon. Tayo ay nasa
Yeah.
buwan nila ngayon. Kailan
Opo.
kaya yung buwan ng mga kalalaki? But nevertheless, as I was able to say kanina na yun nga na nagbigay ng or merong batas no regarding sa women and PhilHealth, your side of the fence had this many things in mind or many attributes to give, or rather many informations or management aspects na nabukas or nabuksan ng PhilHealth, like reducing maternity or maternal mortality, at ending all preventable deaths under 5 years of age, universal access to sexual and reproductive care, family planning and education, and achieving universal health coverage. And Kuya MJ, syempre,
Yes. Kuya Mike.
nahihirapan akong i-explain itong mga to. Pwede
Yeah,
bang
dapat
baka
may
mahirapan
resource
tayo
persons
dahil nasa
tayo
male
po.
side tayo.
Yeah, we need the women talaga, Kuya Mike. So it is but of importance na ang mga guest natin ay mga kababaihan. Girl power tayo ngayon, Kuya Mike. So, Kuya Mike, would you allow me? I'll introduce
Please.
first. Yeah, I'll introduce the guest. So, our first guest, Kuya Mike, is one of our medical specialists dito sa PhilHealth Regional Office 9. She is Doktora Jhoanna Sator Chua, Medical Specialist 1. Good evening, Doktora Chua.
Hi po, Doktora. Welcome to the program.
Unmute, Doktora,
Unmute po
unmute.
tayo, Doktora.
Please unmute.
Hi, sorry. Good evening po, everyone. Good evening to the listeners and the viewers of your show, Sir Mike, La Guardia News Online. We are very delighted for inviting us to your show to share our some of our PhilHealth benefit packages for women. As today is Women's Month, March. It's not only for the Philippines, but it's international. So we're very delighted po. Thank you.
Thank you. Thank you, Dr. Chua. Bale, the second guest po, Kuya Mike, is a nurse by profession. She is Miss Cindi Mason. Together with Dr. Chua, they're both God advocate of PhilHealth Regional Office 9. So good evening, Miss Mason.
Hi po. Good evening po, Doktora.
Hi po,
and
good evening.
Ma'am Cindy.
Yes. Hi po, good evening, Sir Mike, and Sir Mike as well, Sir MJ, and to all the televiewers, not just here in the Philippines, the global televiewers natin. Thank you so much for having us here. May we have a fruitful discussion regarding different topics, most especially for our women because we are celebrating the International Women's Month. So, yun. I hope that you will be enjoying tonight's topic. Thank you.
Hey, thank you. Thank
Definitely.
you.
Definitely. I would like to
So-
learn a lot, no, from women, especially their health care. Kasi syempre, I need to take care of my wife. I need to take care of my daughter. The only way to understand that is when I get to learn from PhilHealth. How does it work? How can I prevent such things, or where can I bring them? So, partner MJ, Mike and Mike pala tayo. M&M pala tayo, partner.
Eminem, yeah, correct. So, Kuya Mike, can I start the ball rolling na?
Please, Kuya MJ,
Okay.
go ahead.
Good evening, Dr. Chua, and good evening, Ma'am Cindy Mason. Po. So, first things first, no? So, we're talking about Women's Month, mga dapat na gagawin yung mga benepisyo na matatanggap ng mga kababaihan sa PhilHealth po. So, first question ko po is, ano-ano yung mga benepisyo na sagot ng PhilHealth para sa mga kababaihan?
Thank you po. Thank you, Sir Mike, Sir MJ. For that question, before I go through the benefits for women about to give birth, I want to give you some of the salient points po of this package.
Please
So,
go
PhilHealth
on,
shall-
Doktora.
Okay, thank you. PhilHealth shall ensure that women about to give birth shall have financial risk protection during pregnancy, delivery, and postpartum through the enrollment to the National Health Insurance Program. So the first salient point is, yung PhilHealth po ay for all maternal deliveries regardless po sa parity. So meaning, only birth na siya. Unlike po before, we only cater to until 4 deliveries. So now po, only birth. So next point, salient point po is that PhilHealth also shall cover admissions due to pregnancy-related conditions such as preterm labor or yung pregnancy-induced hypertension. And then another salient point is that only the low-risk normal vaginal delivery shall be compensable in the non-hospital facilities such as the infirmaries, the birth clinics, the maternity clinics, and birthing homes. What do you mean by low risk? Ito po yung mga walang komplikasyon, absence of complications. So, para lang po dun sa those that are not that shall not be reimbursed po sa mga non-hospital facilities, ito po yung mga conditions so that you may know, yung maternal age po na 19 years old at the date of delivery. Then, yung first pregnancy, the patient is age 35 years old or older. Yung multiple pregnancies such as twin or yung triplet deliveries. Yung may ovarian of abnormality such as ovarian cyst. Yung may placental abnormality like placenta previa. There's a abdominal fetal presentation like yung breech, yung nauna yung buttocks or yung puwet sa panganganak during delivery, or yung may history of 3 or more miscarriages, or history of one stillbirth. And also, next is the history of major obstetric and gynecologic operation like yung may CS. So, hindi na siya pwede sa non-hospital facility. And next, second to the last is yung history of medical conditions like yung patients with hypertension, diabetes, may heart disease, asthma. So, hindi na siya pwede sa non-hospital facility. Other risk factors such as vaginal bleeding and premature contractions. So, yun po yung mga shall not be reimbursed. So now, let's go to the benefits. Ito na po yung importanteng mga benepisyo na binibigay po natin sa mga kababaihan po. So yung first is from our PhilHealth Circular 2015 of 0025, we have the maternity care package. Yung maternity care package or yung MCP, this covers the essential health services yung during the antenatal or yung prenatal, yung stages of labor, yung normal delivery, and yung postpartum period. So magkano to? Yung halaga po ng package is 6,500 and for the hospitals. And for the infirmaries po, this is 8,000. So Minimum stay siya for 24 hours dapat, and the breakdown for this is 60% po para sa facility and 40% for the professional fee. So yung next package po natin is yung normal spontaneous delivery package. So this package is for the vaginal deliveries and the postpartum period within the 74 hours and 7 days after delivery. So how much po naman ito? So the hospitals, it's 5,000, and for the infirmaries, birthing homes, and maternity clinic, nasa 6,500. So yung third package po natin is the antenatal care package. So meron na tayong for delivery, meron tayong for delivery and prenatal. So yung prenatal na lang, so ANC is 1,500. So ANC 0 po yung package niya. And then ANC 01, I mean. And then ito po kailangan at least 4 prenatal checkups or visit, with the last one during the 3rd trimester. And the next one is yung ANC or the antenatal care package of 02 with intrapartum monitoring is, the package po is 2,150. Ang breakdown niya, yung ANC is 1,500 plus yung intrapartum niya is 650. So for the other methods of delivery covered po ng PhilHealth, so we have for the cesarean section, it's 19,000. The complicated vaginal delivery is 9,700, while yung breech extraction is 12,120, and yung vaginal delivery po is, after cesarean section, is 12,120. That's for our packages.
Yeah, that's good to know, Dr. Chua, that PhilHealth is offering plenty benefits with regard to maternal care, and it's in accordance to the advocacy of DOH to minimize zero yung birth death ng mga, di ba?
Yeah.
So it's good to know that PhilHealth is very helpful with regard to deliveries po. Yes, Kuya Mike.
Yeah, actually Kuya MJ, nakakagulat at yung mga binanggit ni Doktora ay pretty much ito yung mga dinaanan ng wife ko.
Yeah.
So, pagka nangailangan pala ako nitong mga to, lalo na nagtataasan ang presyo ng gasolina. For sure, nagtataasan din ang mga presyo ng bayarin sa ospital, ay napakalaking tulong po nito. These are very big help. So, dahil napag-usapan na po natin yung mga benepisyo para kay nanay sa panganganak, may benepisyo rin po ba si baby na sagot ng PhilHealth?
Yes, sir. Let me answer that question. So definitely, sir, kapag si mommy, merong benefits for that, most probably si baby, meron din pong benefits for that, sir. So aside from the MCP-01 and other normal spontaneous delivery packages, we have this what we call the Enhanced Newborn Care Package, or what we call the ENBS. So this is based from PC or PhilHealth Circular 2018, number 21. So ano po ba ito? So it is really good to know, no? This is to create awareness for those mothers and soon-to-be mothers to know about na, ay, meron palang benefits din para sa baby ko. So first, what is this circular all about? So let me have this brief, sorry, nahulog.
Hey,
Hello?
Ma'am Cindi.
Yeah?
Okay.
Claro?
Klaro, Ma'am
Okay.
Cindi.
Sorry, nahulog po yung
It's okay.
AirPods. Okay. Okay. So, first is, what is this ENBS all about? So first, we have this timely cord clamping, and next is to promote early skin-to-skin contact with the baby and the mother. Why? Because we have this DOH mandate, yung, as we all know, the unang yakap. So, dapat may contact si baby with the mother, and as well as we have here the immediately drying and weighing of baby. That's one of the most important thing to do after delivery. We also have here vitamin K, eye ointment prophylaxis, vaccines such as Hep B and BCG. We also have here non-separation of mother and baby for early breastfeeding initiation. So, ang tanong dyan, sir, magkano po ba itong package na ito? So, yun kasi yung common na question. So, first, we have two amounts for this. So, it differs kung may hearing test or walang hearing test. So, first, kung may hearing screening test po, it will cost 2,750. So, kung walang hearing test. But kung meron po, plus 200, that is 2,950. Because there are facilities na wala po silang ganong services. But, yun na nga po, mina-minus and ina-add na lang po yung 200 for that. So, yun po. I hope we are clear on that. And in addition po pala, before, yung newborn screening test, nasa 6 lang yung nadedetect na disorders. So, as PhilHealth evolves its packages, its case rates, from 6 ngayon, 28 or more disorders na po yung nadedetect. So, yun din yung maganda sa PhilHealth because we keep on evolving our package rates for the benefit of the people. Yun. Sir?
Thank you,
Definitely,
Miss
definitely.
Cindy.
Kuya MJ?
Yeah, okay. Thank you, Miss Cindy, for that enlightenment with regard to the newborn package for babies. So kanina, Kuya Mike, when
Nagtatanong sana ako, Kuya MJ.
Ay, sorry.
Niisip ko pa nung pinanganak yung anak ko eh. Kaya, pero definitely, pasok yun doon sa mga binanggit ni ni partner, Cindy. You know, we call everybody here partner. We're partners in the service to the Filipino people. So, napaka-relatable nung mga topics na binanggit ni ni partner Cindy. Kuya MJ, please go ahead.
Okay, partner Mike, thank you. As what partner Dr. Chua reiterated earlier na unli na daw partner Mike yung panganganak. So with that regard, no, this is my question. Kasi unli na. Kung sakali nais ng mga mag-aasawa na maayos ang pagplano upang mapalagaan yung kalusugan ng pamilya, may mga benepisyo ba ang PhilHealth para dito?
Okay. Sir, let me answer.
Okay, yes, partner Cindy.
Opo. So, kung sa text may unli text, unli call, sa PhilHealth may unli birthday. So, yun na nga, before, di ba, na-mention natin na hanggang 4 lang.
Apat lang.
Nung nagkaroon kami, years back, nagkaroon kami ng reach out forum sa mga facilities. Sabi namin, ma'am, sir, unli birth na tayo ngayon. Parang unli text tsaka unli call lang pala to. So, yun. But, the other side of the story is, kapag unli birth kasi, yung problema dyan is yung Philippines, di ba, growing yung population. Anong year pa nanalo si Catriona Gray? Sabi niya, 104 million na at that time. So, after ilang years, lumalobo na. So, we here in PhilHealth, we also have different methods, different packages that caters this kind of family planning. So, yun na nga, again, family planning kasi, it is really important that both the couple, the husband and wife, should decide kung ano ba yung naaakma sa kanilang method, no? So, we here in PhilHealth, we have these packages. So, first, we have intrauterine device or the IUD. So, we also have no scalpel vasectomy. We also have subdermal contraceptive implant package and the bilateral tubal ligation. So, first, what is IUD? So, yun. Meron lang pong IUD, meron pong device na i-insert po sa uterus or sa mattress ng babae. So, it is to prevent pregnancy. So now, it is also to provide women access to family planning procedures aside from hospitals and ambulatory surgical clinics. So, in PhilHealth po kasi, hindi po lahat ng facilities cater or nagbibigay ng ganitong services. So may mga may mga facilities na dapat accredited din po sila to conduct this kind of procedure. And it is also very important for us to know that yung package rate for this is 2,000 pesos. So, okay. Moving forward, we also have the no scalpel vasectomy for men. For men. Hindi lang sa amin mga babae, pati din sa inyo meron din. So, what is NSV or no scalpel vasectomy? Yun.
Pasok, pasok pala kami sa package. So,
Yes po, sir.
So,
Yes
magagamit
po.
din
So,
yung PhilHealth namin.
Yes po. If willing po kayong mapavasectomy, why not?
Oo.
Willing ka ba, partner Mike?
Willing ba kayo?
Well, bakit hindi? Bakit
Oo.
hindi?
Okay. Sige
Pero of
po.
course,
So,
nagdadalawang isip yun.
sige po. So baka pagkatapos kong i-discuss yung package nito, baka di na kayo magdadalawang isip, sir. So it is the no scalpel vasectomy. It is based from PhilHealth Circular 25 of 2015. So yung package rate for that is 4,000 pesos. So a brief discussion lang po. It's a modern method. It's a modern method of delivery, ligation, and excision of vas deferens. Vas deferens, it's a part of the male reproductive system. So, it provides sterilization option for male. So, again, hindi lang po for women yung mga ligation. So, it is safe, effective method of vasectomy with low complication and greater patient compliance. So again, NSV or no scalpel vasectomy, that's 4,000 pesos. So third, ito po yung nabanggit ko na subdermal contraceptive implant. So again, this is for women din, based from PhilHealth Circular 2015, number 38. So ano po ba itong subdermal contraceptive implant package? So, it is a long-acting, reversible hormonal contraceptives that inhibit ovulation by suppressing a particular hormone sa babae. So, gaano ba ito katagal effective? So, its effectivity runs 3 years. And take note, yung package rate for this is 3,000 pesos. And yung package po kasi natin is divided into two. We have amount for the hospital. We also have amount for the professionals or professional fee. That's what we call. So for the facility, we will be giving 1,800 pesos, and for the professional fee for the doctor or for the professional who will be conducting this kind of procedure, 1,200 po. So that sums up to 3,000 pesos. And ito po yung pinaka-importante din, no? It can be availed once in every 730 days or 2 years. So once lang po in every 2 years. Yes po. So if ma-avail siya less than that specific time, so hindi po mababayaran ni PhilHealth yung benefit package. So kasama din po doon yung sa package is yung consultation, counseling for the patient, the medicines, and as well as the supplies, and follow-up counseling and procedure after the procedure as well. And lastly, we have this bilateral tuba ligation, which amounts to 4,000 pesos. So yun. So that's all for the family planning.
Thank you, partner Cindi, for again enlightening. And as you told earlier, no, saklaw yung ng PhilHealth with regard to family planning, babae at saka lalaki. So it really says na it takes two to tango, di ba?
Yes.
Partner
And
Cindi?
yes, sir. And it's gender equal. So
Equality,
we are here.
yeah.
Yes, yeah.
Yeah.
We promote equality here. Yes.
Yeah, that's right.
I will be the cultural devil's advocate.
Okay, yeah.
Iisip muna kaming mga lalaki ng twice. Di ba yun yung normal, no? Majority of our kababayan, especially the male ego.
Machismo, yung machismo,
Yes,
partner.
yes,
Yeah,
yes.
machismo.
Pero dahil dyan sa machismo nyo, pag kayo'y napilitan at walang choice, tandaan, babayaran ng PhilHealth. Willing ang PhilHealth. So hindi
4,000 pesos,
Yes.
di ba?
Yung-
4,000.
4,000.
Okay? So, Itong mga nakarang mga panahon, we've been into COVID and such. Pwede ba malaman kung partner, na isip ko lang, pwede ba malaman kung sakali nag-positive si nanay o si baby sa COVID-19, sagot pa rin ba ito ng PhilHealth?
Ah, yes, yes po, partner Mike. May mga packages po kami for COVID. So, as long po na ang patient is positive with COVID-19, mild, moderate, and severe, and critical, and with pneumonia, mababayaran po ito ng PhilHealth. Otherwise, kung hindi siya, wala po siyang pneumonia, so yung maternity package is the compensable package for them. So for the COVID-19 packages, so we have for mild pneumonia in the elderly with comorbidities, we have the 43,997. For the moderate naman, we have 143,267. And for the severe COVID, it's 333,519. And for the critical package naman, it's 786,384. That's for the PC number 2020-009. Pero meron po kaming bagong circular for admissions po na from March 22, 2022 onwards. We already pay po yung mga without pneumonia. So po, pag yung nanganak po, yung pregnant na pumunta sa hospital na without pneumonia, babayaran na po siya ng PhilHealth. And also for the pedia po, yung mild disease with risk factors without evidence of pneumonia or hypoxia but with risk factors na magpaprogress siya or with comorbidities, babayaran na din siya ng PhilHealth for the COVID packages. That's all po for the COVID package po.
Partner MJ?
Yeah, okay. Hearing from that, Dr. Chua, partner Chua,
Thank you, Doctor.
it's evident that PhilHealth is really helping or extending its benefits to PhilHealth members and its dependents. So, bukod sa mga benepisyo po sa kababaihan at sa mga babies, may mga benepisyo pa ang PhilHealth para sa mga lubhang sakit or karamdaman po?
Yes po, partner Mike MJ. For this po, we have po what we call the PhilHealth Z Benefit Package po. This is for the catastrophic cases po ng PhilHealth na this Z benefit siya in the sense na these conditions incur very costly hospitalization and treatment management. So that's why the PhilHealth came out po sa Z-Ben packages. This is under po sa PhilHealth Circular 2015-035. So in relation to women, so yung breast cancer po na Z benefit is 100,000. And for the cervical cancer po, it's 125,000 chemo with cobalt therapy. And for the chemo with linear accelerator and brachytherapy, nasa 175,000. So ito po siyang mga Z-benefit package. Meron po siyang mga specific requirements that we need that is required. So you can visit po our website if you are interested po. And not all of the hospitals or all the regions have all the packages. So you have to check po kung it is available po in your region or in your area so that you can avail po this Z-benefit package that I think it's very good for the people po, for our kababayans po, especially our women who have breast cancer and cervical cancer. Thank you.
Okay, Dr. Partner Jhoanna, for the benefit lang po, for example po sa region natin, sa PhilHealth Regional Office 9, is there an accredited facility who caters Z benefits ba?
As of the moment, the one that is accredited is the Zamboanga City Medical Center. Yung cervical cancer package po is the one they applied for, but I think it's still on process.
One more thing, partner Doktora, for the benefit lang po, partner Mike. If, no, an example, a patient from Zamboanga or from Region 9 gusto niyang mag-avail ng Z benefits sa Manila, pwede ba yon?
Yes, yes, they can always avail to the Z benefit package to any accredited facility for Z benefit.
Who are catering Z benefits? Kasi
Yes,
iklaro lang natin,
because they have to
partner Mike,
they
kasi,
have to be
yeah.
accredited for the Z benefit. So it's a special, not like the regular packages. So they have to apply po sa
Okay.
PhilHealth accreditation to be able to
Serve
cater
them.
to
Yeah.
to serve them with this Z benefit packages.
May,
So,
may solusyon
partner
ako
Mike,
dyan.
Opo, yes, partner Mike.
Dapat kumontak sila sa PCares para makuha kagad nila yung kung ano yung lugar na mayroon. All over the country, ha? So,
Yeah,
PCares
correct.
is just a contact number away at babanggitin niya ni partner MJ. At malalaman niyo yan, i-type niyo lang sa website or punta lang kayo sa website ng PhilHealth. Tapos, PCares nakalagay doon. Because we care. So, di ba, yun naman yun. So,
Yeah.
ask them and they will point you kung saan yung pinakamalapit. Since we are broadcasting global, and for those who are not part of this live broadcast, pag napanood nyo ito ulit at narinig ninyo, automatically go to your PhilHealth PCares and kung nasa ospital ka na, marami naman mga ospital na may PCares, no? Kung
Yes.
hanapin mo lang dyan yung Malasakit Center, hanapin mo dyan yung PhilHealth na nakalagay doon, and they will give you the list. So, yan ang maganda, partner MJ, no?
Yes, partner Mike.
With the
I
information
agree.
that Doktora gave. So, regarding that, partner MJ and Doktora and partner
Cindi.
partner
Cindi.
Cindi. Yeah. Even with my glasses, I'm blind. So, I'm sorry. So, gusto ko lang kasi mabigyan ng atensyon yung pong ating mga kapos sa buhay. Sa mga kababaihan na kapos sa buhay at walang pambayad sa ospital, maaari pa rin ba silang mag-avail or maka-avail ng mga benepisyo ng PhilHealth?
Yes, sir. Definitely. Because as social health insurance, si PhilHealth po, kino-cover niya po lahat. All Filipino, from all walks of life. So, itong mga, meron tayong package, meron kasi tayong policy for that. That's what we call the no balance billing policy under PhilHealth Circular 2017, number 17. It states that no other fee or expense shall be charged to the qualified indirect members. So, sino-sino po ba itong mga indirect members na ito? So, or indirect contributors. So, these are the indigent, o yung mga properly assessed by the DSWD. Meron din tayong mga dependents din po ng ating mga lifetime members and senior citizens. So tanong sa amin before, mga senior citizens ang makaka-avail ng mga maternity care package? So the answer there would be for their dependents. Yes, if they have dependents still in their reproductive age, so they can use this kind of packages. And we also have what we call the immediate eligibility. Sa lahat po yan, or because nag-sort po ito nung nagsimula ang Universal Healthcare Law. I guess it's around November 2019. So let me read lang po. No? This is from PhilHealth Circular 2019, number 10. It's all Filipinos shall be granted immediate eligibility and access to PhilHealth benefits. So meaning, wala na po yung mga sinasabi natin before na kailangan may 3 months or 9
Official
months.
regularity, yeah.
Yes, wala na po yun. So when UHC started, we adopted, Philippine Health Insurance Corporation adopted the immediate eligibility. So for example, pwede mong magamit kaagad kailangan mo lang talagang bayaran yung lapses mo from November 2019 up to the present, or kung wala ka namang lapses, that's very good. That's why we keep on reminding our members and mga non-members na apply no to PhilHealth, because it's very important sa ngayon, sa health ngayon, and dapat updated din po yung mga payments para wala na po tayong problema when it comes to admission. Pagdating natin sa hospital, may konting requirements lang ipapakita, and that's fine. If okay ang contributions natin, that's fine, that's okay. But if we have lapses, naku, yun yung problema natin. But even though it's a problem, there's still a solution to that. So the member should pay the lapses lang talaga para magamit ka agad. So yun.
Thank you, Partner Cindy. Yes, Partner Mike?
Wala, Partner MJ. Pinakinggan ko lang si Partner Cindy. Medyo ninanamnam ko lang yung kanyang sinasabi kasi ganun pala yun. Kailangan mo palang pwede pala na maka-avail ka na, di ba yung no balance billing, narinig ko yan kay Partner Delio yung no balance billing, tapos meron ng pag matagal ka na nakapag hulog, like you've made your payments for more than a year, so okay na pala di ba? Babalik, kumbaga balik loob ka lang, mag-reapply ka lang, magparamdam ka lang na I'm here, I would like to be part of the universal healthcare law, and would like to go back to the arms of PhilHealth. So to speak, no? Napakadali pala. So,
Yes.
Partner MJ, go ahead with your question.
Okay. Hearing all the benefits that PhilHealth is catering for women, children, and syempre, pati tayo mga lalaki po, Partner Mike. So, with that regard, no, paano makaka-avail ng lahat ng mga benepisyo na sinabi natin? Yun yung question ko. So, how can the women avail of those benefits you told us earlier?
Okay, so to be able to avail po sa PhilHealth benefits, so mag-register lang po tayo to be a member of PhilHealth. So pagparehistro sa PhilHealth bilang membro, we can fill up po ng PMRF form, yung PhilHealth Membership Registration Form. We can visit po our local health insurance office. It is meron po siya in all the regions, in all the areas po sa Philippines. And you can update po yung sinabi ni Partner Cindy kanina, you update yung ating member data record. If we have additional dependents, we can add them. And also, dapat po updated yung mga premium contribution. So as Partner Cindy mentioned also, the start of our universal healthcare law was last November 2019. So dapat po updated po yung ating premium contribution. And then, para po mapadali ang pag-monitor ng kanilang mga PhilHealth record, inilusad po ng PhilHealth ang online member portal sa aming official website po sa www.philhealth.gov.ph. So they can visit po our website for the online member portal na pwede nilang ma-monitor ang kanilang PhilHealth record. That's all.
So, hearing that, Partner Dr. Chua, so all we need to do is to register and pay your premium so we can avail of all the benefits ng PhilHealth po anytime, anywhere sa mga accredited hospital, right? Yes, Partner Mike. Yes, Partner Mike.
Nakamute. 1 second. Yan. Nakamute ako. So, yes, no. I was listening, Partner MJ, actually. Meron kasi akong naalala na meron pala akong mumunting paalala para sa lahat ng mga nakikinig sa pamamagitan ng isang magandang video. So, Thank you very much for the informations of Dr. Jhoanna S. Chua and partner Dr. Jhoanna Chua and partner Cindi Mason. Partner, may mason pala tayong kasama kaya pala behave tayong dalawa eh. Just
Yung
kidding
totoong
aside.
mason, sir.
Kasi Freemason si Kuya MJ
Ako,
talagang
apelido ko
yun ang
yun, sir, eh.
apelido.
Lido lang yan
Oo.
ni Ma'am Cindy, partner. Opo.
Okay. So, with that, tayo magbe-break po muna at magpapaalala na rin po ako ng kung ano po ang gagawin ninyo katulad na nabanggit ni Dr. Jhoanna.
Magandang balita para sa lahat ng mga PhilHealth members. Maaari na ma-view online ang inyong membership at contribution records gamit ang PhilHealth Member Portal. Hindi na kailangan lumabas pa ng bahay at mananatiling ligtas kasama ang iyong pamilya. Sa pamamagitan ng inyong smartphone o computer, sundin lamang ang mga sumusunod upang ma-access ang inyong PhilHealth Member Portal. Step 1. Pumunta sa PhilHealth website na www.philhealth.gov.ph. Step 2. I-click ang Online Services. Sa kategory ng Membership, i-click ang Member Portal. Step 3. Mag-create o gumawa ng user account. I-click ang Create Account at sa Member Portal Account Creation, punan lamang ang mga hinihinging personal information at gumawa ng inyong sariling password. Step 4. I-activate ang link na ipinadala sa inyong email address. Step 5. Mag-login gamit ang inyong PhilHealth Identification Number at ginawang password. Kopyahin ang CAPTCHA number at i-click ang Login. Matapos mag-login sa inyong account, makikita agad ang inyong member information at mga pangalan ng idineklarang dependents. Kung nais mag-download at mag-print ng inyong member data record, i-click lamang ang Print MDR. Para naman ma-view at matiyak na tama ang inyong binabayarang kontribusyon, i-click lamang ang Premium Contribution. Hindi lang yan ang serbisyong pwede makamit sa paggamit ng inyong PhilHealth Member Portal dahil maaari ka na rin makapag-generate at makapag-print ng Statement of Premium Accounts o SPA, ma-view ang iyong SPA history at higit sa lahat, makapagbayad online. Upang makapag-generate ng SPA, pumunta sa Payment Management Module at i-click ang Generate SPA Submodule. Sunod ay piliin kung ilang buwan ang nais bayaran. Ang lahat ng SPA na na-generate ay maaaring makita sa View SPA History submodule. Matapos makapag-generate ng SPA, maaari na makapagbayad. Mamili lang ng payment partner sa mga nakadisplay na icon at paraan ng pagbabayad kagaya ng credit card, debit cards at prepaid cards. Kung successful ang payment transaction, makakatanggap ng Electronic PhilHealth Acknowledgement Receipt o EPAR na maaaring i-download o i-print sa PhilHealth Member Portal. Makakatanggap din ng electronic receipt mula sa payment partner kung saan makikita ang kontribusyon at convenience fee na binayaran. Automatiko naman magre-reflect ang inyong binayarang kontribusyon sa Member Contribution Payment History ng inyong account. Kung hindi pa din posted ang inyong binayarang kontribusyon makalipas ang 24 oras, maaaring tumawag sa PhilHealth Action Center para sa assistance. My PhilHealth Portal. Easy, fast, hassle-free.
Okay, partners. So tayo nagbabalik na sa ating
partner.
palatuntunan. And yan po ang paalala ng ating PhilHealth para po sa portal. I would like to, in this juncture, I would like to, in this portion of our program, greet all of our Corps of Advisors, mentors, supporters, and partners. To former Police Director General Edgar Aglipay, Marinette Yan Aglipay, Ella Aglipay, DELIO and family, Congressman Michael Edgar Aglipay, USEC Emlyn Aglipay Villar, former DPWA Secretary Mark Villar, Teresita Castro Yan, Brigadier General Emiliano Templo, Kuya Colonel Edison Bong Nebriha. O nga po pala, I would like to extend our prayers for the death anniversary of Mr. Roberto Yan, the husband of Ma'am Teresita Castro Yan. And of course, to greet Kuya Ramon Bergado, the National President of PADPAW, Kuya Juanito June, and ating Ofer Lua of JSL Security Group, Kuya Eros Zuniga, President, Safety Organization of the Philippines, Kuya Colonel Val Hizon, President, Philippine Association of Security and Safety Management, Kuya Colonel Almus Alabe, Mall Security Managers Association of the Philippines, Kuya Dr. Estelito June de la Cruz, Mall Security Management Association also, and kay Kuya Dr. Loy Reyes of the Campus Security and Safety Management Alliance of the Philippines, and Don Bosco Technical College alumni, and to former DILG Secretary Rafael Alunan, Rafi Alunan, sir, at to all partner organizations natin, officers and members, Aspire, PAC SRMS, SESMAP, Security Guards 59ers Alliance of the Philippines, ACSTAP, Association of Certified Security Trainers of the Philippines, SPCV Federation headed by Erwin Santos, at sa lahat ng bumubuo ng Rizal Federation of Community Advocacy Groups or REFCAG, ADLAGCAG, Anghel de la Guardia Community Action Group, Baguio, Valenzuela, and Rizal, Rizal PNP Press Corps 2022, at sa Taytay Security Action Force, Anti-Crime, Anti-Poverty, President Ate Feli Real, sa Bantay Lawa, Taytay Municipal Station Advisory Group, and members headed by its advisor, Police Lieutenant Colonel Francis Panisan, Philippine Investigative Media Alliance Inc., si Dakma Riders Group, at ang the Fraternal Order of Eagles, Philippine Eagles, Central Luzon North, Fortis et Kingua Club, and all kuyas, ates, and bunso. So, Kuya MJ, gusto rin natin ipabatid at ipaalam sa lahat ng ating mga kababayan na mag-ingat sa mga kumakalat na fixer online na nag-aalok ng serbisyo ng PhilHealth. Walang bayad ang pagkuha ng PhilHealth ID at Member Data Record or MDR. Mahigpit na ipinagbabawal ang fixing sa ilalim ng Ease of Doing Business and Efficient Government Service Delivery Act of 2018. Ang sinumang mahuhuling gumagawa nito ay maaaring magmulta ng hanggang 200,000 piso o makulong hanggang 6 na taon. So, yan po ang information na dapat po natin malaman at makalap po. Marami po tayong gustong itanong, pero puro pagbati na lamang po yata ang naririto. So, konting pasada lang po ng mabilis para po sa mga gustong magpa-shoutout, at kung may mabasa po tayong tanong ay pakisagot na lamang po. So, umpisahan ko na po. Greetings from Ahmed Atibon, TR Ranoco, MJ Panaligan Dakila, Aljan ADR. Good evening, Sir Michael, and to your guests tonight. Thank you po. At sabi ni Philip Cataylo, good evening, Sir Mike, La Guardia DATUIN, Michael James, Michael Jones, Susa Lahi, Dr. Jhoanna Sator, Chua, and Cindi Mason for more power to PhilHealth and La Guardia News Online. Thank you po.
Thank you, Philip.
Yan, at okay, naglalag kasi yung aking laptop. So, Joyce Lynn Esparagera, good evening, Kuya Mike de la Guardia. Good evening, Sir Michael Lahi, Dr. Jo, and Miss Cindi. And good evening to all. Good evening po,
Joyce.
Sir Mike. Sabi ni MJ Panaligan Dakila. Dr. Loy Reyes, good evening din, everyone, sabi niya. At Otseno Esoj, good evening, Ma'am Layloy? Ma'am Laylay. Yeah, sino po si Ma'am Laylay? Doktora? O si Ma'am Cindi?
Hindi po kami, sir.
Ganun. Sino kaya si Ma'am Laylay na sinasabi? Otseno Esoj, good evening, Sir Michael Lahi. Bakilalin, Sir MJ. Philip Cataylo, good evening, Laylay Otseno Esoj. Yan. Otseno Esoj, good evening too. Sir Philip Cataylo. Yan. Eto, sumagot na si Leylay. Good evening daw, sabi ni Leylay. Good evening, Sir Philip Cataylo. And, ayan, sabi ni Leylay, good evening everyone. Sabi ni Sir Philip Cataylo, good evening, Seng Hie Song. Otseno Esoj, sabi niya, thank you so much, very informative. Sabi ni Ate Feli Real, gandang gabi po sa lahat. At ito sabi ni Leylay, good evening Sir Philip Cataylo and Sir Otseno Esoj, more power to this show.
Asawa yan ni Philip, Kuya Mike. Asawa ni Philip. Asawa yun si Miss Leylay, asawa ng partner ko si Philip Cataylo. Good evening.
Hello
Thank
po.
you for viewing po. Thank you.
Sabi ni Sheng Ye Sung, Camille Queenie, Isabel. Okay. Sheng Ye Sung, Questar, Sheena, Casey, Ace, baka mga tinatag niya ito. Ace, Frances, Pilar Luz, Biggie, Ana Lu.
Oo
Okay.
nga, sir, baka yung mga tinatag.
Di ba parang ganun yun,
Miss
ano?
Sheng.
So, ayun, batingin
Opo.
na rin natin yung mga tinag mo. Baka nakikinig sila o nanonood na sila.
Good evening.
Sabi ni... So, okay. Nasaan na ba ako? Balik ako ulit.
Mga God advocates din sila, sir.
Sir MJ, can you see the comments? I shared it with you. No?
I can. Yeah, I cannot.
Oh,
Sorry.
okay. So, if you can read it, if you can see it, you can read it also. Philip Cataylo, Queenie Venus Fidel. Philip Cataylo, Halu Nong. Yan, sabi ni Queenie Venus Fidel.
Hello, Queenie.
Seng Yesong, Takiya si Mamang Queenie. Halu, di ko matag si Ate Cheche. Okay. Ay po. Sige po, tag nyo lang po.
Mga supportive.
Mga supportive
support.
Pro 9
Sabi ni Shane
teammates.
Marlo, good evening po sa lahat. Keep safe and God bless everyone. That's from Pililia, Rizal. Ruben Abarca, hello everyone. Philip Cataylo, good evening Ruben Abarca. Rex Venige Lagarde. Okay, so I guess there's no question.
Good evening,
And,
Ruben. Yeah.
Since there's no question, siguro partner MJ, we can ask our
Parting words
guests for their parting message.
Okay, let's hear it first from Dr. Jhoanna Chua. Partner, Dr.
Yes. For my parting words, so health is wealth. Prevention po is better than cure. So since PhilHealth is your partner in health, so I remind everyone to update your premium contribution and update your MDR so that for any time you need PhilHealth, you can avail the benefits po. Na it's very helpful po for all our Filipinos, STEM Filipinos and women in everywhere. So thank you po and God bless.
Thank you, partner, Dr.
Maraming
Jhoanna.
salamat.
Partner Cindi, your parting words po.
Yes, sir. Please give me an opportunity po to
Okay.
highlight lang po yung mga as God advocates, we also have we will be celebrating the Women's Month, the entire month of March. So ano ko lang po, emphasize ko lang yung mga activities din po ng PhilHealth Regional Office 9 God Advocates, no. Pa-shout out din po pala sa lahat ng mga God Advocates na nanonood ngayon, sa mga Pro 9 supporters, thank you. So short lang po, we will be having or conducting Women's Forum for all the PhilHealth employees within the region. We will be also having this kind of exhibit po. So ano po yung kind of exhibit? So lahat ng mga employees, women employees na entrepreneurs, yung may mga nagbebenta ng mga food, nagbe-bake, mga crafts. We have a specific date for that. So open po yun sa lahat ng sa amin, sa mga employees din. Para ano po, to help people know that women can have also this kind of small businesses. So supporting each other lang din po kami dito sa Pro. And we also have ito, yung Usapang Philhealth para sa mga kababaihan activity. And we also have trivia, question and answer portion in one of these days. So, pa-shout out po pala sa family ko, sa parents ko. I know you're watching right now, to my ate and to my siblings there in Cebu. Mayong gabi. Yun, thank you for watching. And to all of my friends all over the globe, I know you are supporting us here. So, thank you so much. Yun. So we hope that this is a very fruitful discussion for us all. If you have questions, please do not hesitate to ask any of our PhilHealth employees, or just reach your nearest PhilHealth office, no, in your area. So we will be happy in serving you all. Thank you.
Thank
Thank
you.
you.
Meron palang
Okay.
event si partner Cindy. Dapat ma-invite mo si Dr. Derek Ramsey ng region.
Sige. That's
Jane
a good
po, Dr.
idea,
Jane
Dapat
sir.
po.
antayin mo yung banda nila, di ba? May band siya,
Yan.
si Doc.
Si Sir Opo. So yun, pag-uusapan namin ng mga God advocates yan. Salamat. Shout out kina Ma'am Che, Sheng, and to all of the God advocates. Thank you so much.
Yan. Thank you. Thank you po, partner Dr. Jhoanna S. Chua and partner Cindy Mason. Thank you po.
Yes, Partner Mike. Uh, uh, Partner Mike, good
Yeah,
evening.
go ahead.
I would like to take this opportunity also, no, to thank our two guests, si Dr. Jhoanna Chua and Ma'am Cindy Mason, for sharing their invaluable time in reiterating and telling PhilHealth benefits for women, specifically that we are celebrating Women's Month this month of March. For and in behalf of our Regional Vice President, RBP Paulo Johan Perez, this is partner MJ Lai po ng PhilHealth Regional Office 9 saying stay safe, always po tayong we keep ourselves healthy po and happy. Good evening and thank you for sharing your time with us this evening's show. Thank you, Partner Mike.
Lahat ng ating partners, PIOs ng NCR and Region 10 of PhilHealth wishes to remind everyone to join us every Mondays at 8 p.m. here at La Guardia News Online sa Usapang Philhealth. The Philippine National Police Security Protection Group, Police Colonel Jewel Neil Salcedo and all executive officers, and to Police Major Jack Casas, Chief Public Information Office, Chief, PIO, PNP, PSPG, and Team, PNP Police Security Protection Group, Advisory Group Chairman, Dr. Reyes Romero, and Council, along with my partner, co-advisory group member, Louis Domingo, wishes to remind everyone to join us every Thursdays at 8 p.m. here at La Guardia News Online sa Basta PSPG Trustworthy Program. The Rizal Acting Police Provincial Director, Police Colonel Dominic Bacay, and all executive officers, especially to Picadu Chief, Police Lieutenant Colonel Resty Damaso, and Police Lieutenant Marisol Taktakin, Chief Public Information Office, Rizal Police Provincial Office, along with all the Chiefs of Police and PCR officers, men and women of all 14 police stations of Rizal, wishes to remind everyone to join us every Tuesdays at 8 p.m. here at La Guardia News Online sa Usapang May Diwa, Seguridad at Kaligtasan, with replay broadcast every Saturdays at 3 p.m. via DWDD 1134 kHz AFP Radio and via online live through AFP Radio FB page. All technical staff ng DWDD 1134 kHz Armed Forces Radio Group headed by Sergeant Angel Camomot, marami pong salamat. Also to our MCAD Commander and Station Manager, Major Sinon C. Pancito III, the Philippine Army, through the command leadership of CRS Commander Major General Manuel V. Secatin. Kami po'y nagpapasalamat ni Partner MJ Lahi sa lahat po sa inyo at sa amin pong naging panauhin sa araw na ito, kay Doktora and kay Ma'am Cindy, kay Partner Cindy. Maraming pong salamat. At I would like to mention Dr. Jhoanna Chua and partner Cindy Mason. She's a doctor. Dr. Chua is a doctor and Ma'am Cindi is an RN. Tulad po ng lahat ng kwentuhan o usapan, ito po'y may umpisa at may katapusan. Naway marami po tayong napulot na aral at magagandang halimbawa at istorya na magsisilbing handang gabay sa atin sa lahat ng hamon sa buhay. Pag tama ang kaalaman, tiyak ang kaligtasan at kapayapaan ng bawat mamamayan. Ito po ang inyong lingkod, kasama po si partner MJ Lahi, nagpapaalam at nag-aayaya na sa susunod na broadcast po natin muli tuwing alas 8. At nagpapasalamat din si partner Lynn Ibanez na busy lang po ngayon pero sa ngalan ni partner Lynn Ibanez and partner DELIO ASERON, sila po yung nag-imbita sa atin muli tuwing alas 8 ng gabi dito pa rin sa La Guardia News Online FB page at sa himpilan ng Armed Forces Radio sa DWDD 1134 kHz AM band every Saturdays from 3 to 4 p.m. and all its social media accounts at AFP Radio, Mike LaGuardia DATUIN, Anghel de la Guardia, Mike DATUIN, LaGuardia News, and at my Michael DATUIN YouTube channel. Muli po, Mike LaGuardia DATUIN po, nagsasabi at nagpapaalala sa ating lahat ng seguridad at kaligtasan ay responsibilidad ng bawat mamamayan. Mapasaan ka man, lakasan ng loob at magtiwala dahil lahat po tayo ay may Anghel de la Guardia. Partner MJ, thank you and thank you sa
Thank you.
PhilHealth